Hi, my name is Dr. Stephen Stokes, and I'm a chiropractor. I got my chiropractic license in 2001, and I've been treating, ever since then. It's something I enjoy doing. I will never retire. I just sincerely have always liked helping people. When I was first in chiropractic college early on, I thought I needed more, and I was a little bit frustrated with the limitations of simply manipulating the joints, although that's very important, and it does produce great results. I just felt there was more to it. And one day a friend of mine, whose name was Joe Rogers, who is practicing now just outside of Kentucky, he had told me about this doctor in St. Louis. His name was Dr. Michael Fasella. And this guy was getting people better. He was a chiropractor. He was getting people better by just working on muscles. And his idea was that the muscles move the bones don't move the muscles. And I thought that was interesting because I was searching for something more than just joint adjusting. And long story short, I ended up going to his house and meeting him. And while I was there, we had dinner. And after dinner, one of his neighbors came over with a bad shoulder. It was a frozen shoulder. Dr. Fasella worked on that shoulder for 5 minutes. And when he was done, the patient could raise his arm, or the neighbor could raise his arm above his head, something he hadn't done in, he said, 2 years. So I was sold that there was more to it than just adjusting joints. And that started a long relationship with Dr. Fasella and training. And I learned his procedures, which was called NIMO, or receptor tonus technique. I learned about muscles. I learned how important they are in the body. I learned the connection between the muscles and the nerves and even some of the organs of the body. And it was fascinating. And I grew, and I started to get more people better, and I was able to take on tougher cases. I worked in Michigan for a year, Battle Creek, Michigan, where I had a big clinic. We saw about 500 patients a week. It was a great time. I was young. We helped a lot of people. But it was during that time that I realized what I did and didn't want to do. And I realized that I wanted to do more than just adjust people. I wanted to help them change their lives. So I began studying, and I studied acupuncture. I studied osteopathic medicine, studied nutrition, I studied cranial work, right? I studied neuromuscular therapy, and I really increased the amount of tools that I have available to help people. I started looking at patients not as just conditions, like, this guy's a back patient, this is a shoulder patient. I just started looking at them as people. And I started thinking about ways that I could make them better as a whole. And that's what really started my journey into what I do now. The more I learned, the more I studied how the body heals, the more I became convinced of the work, the more I really believe that the body has an innate intelligence that can heal almost regardless of any condition, as long as you give it what it needs. And so my purpose clinically is to just provide patients with the roadmap so that their bodies can do what they're meant to do, which is essentially heal. I see a lot of people from all over the world. I recently had a gentleman come from New Zealand to get some help with his neuropathy. And it's just exciting to be in practice, Every morning I get up and I can't wait to get to work. I can't wait to see people. I can't wait to figure out the individual problems and how to solve them. And that's a big part of the excitement of going to practice every day. I would say nutrition plays a huge part in what we do. Probably more than 30% of all the miracles I see come from diet and supplementation. Most people have no idea how to eat. And so one of the things we always make sure we give every patient is a plan of the best way for them to eat. And of course, supplementation plays a large part in that. Not all supplements are created the same. We only use two main companies. We use Standard Process out of Wisconsin, an American company. And we use MetaHerb, which is from down under. And so, one of the benefits of nutrition is that the results are long lasting. If someone comes in and they have a sore shoulder and I work on the shoulder, I can increase blood flow to the shoulder and make it feel better. And over time, if I use therapies like class 4 laser and pulse electromagnetic field therapy, I can actually help the tissue regenerate. But nutrition is something the patient essentially does on their own. And that's something that can stay with the patient for the rest of their life. We can make massive changes in physiology by just eating the right foods and not eating the wrong foods. One of the benefits of coming to see me as a practitioner, if you live in this area, in the Fort Myers, Florida, Southwest Florida area, one of the greatest benefits that I can bestow on all my patients is education. You know, if you're injured right now, and you're hurting, and you're sick, look at this as an opportunity. This is an opportunity for you to learn about what's wrong and how your body works. And I can provide you with that education so that once we get you out of pain, once we repair the damage, you can stay this way. You can stay healthy for the rest of your life. And that's really what this is all about here at Advanced Pain Solutions. My goal is to get people better and keep them better. I want to make you healthy. And I believe that, you know, since 2001, the experience that I've accumulated can do that for you. There's a lot of people on the internet today with a lot of ideas. You know, on the internet, everybody's an expert. But the big difference between what we do here is that we have the practical experience. You know, I often say to people that when they ask me about research, and I have a lot of research on my website that people can read, but I am not a researcher. I'm a clinician, and there's a big difference. I'm interested in doing whatever I can to produce results in my patients. And the research is secondary. If I see clinical results with something, even if it's out of the box thinking, even if it's something like magnetic therapy, I'm going to utilize that procedure in my patient base because I know it works. And ultimately, what patients want is results. The idea is that you have a problem and I'm the guy that's going to fix your problem. And together, we're going to get the results that we both desire. You know, different people have different goals. Some patients, their only goal is to be out of pain. Other people, they want to be out of pain, but they also want to be able to play, you know, 18 holes of golf. And those are different goals, and they require a different approach. Obviously, you know, there are no miracles. Everything requires hard work, but we do get a lot of patients here that get results when a lot of other practitioners have failed. So I would just strongly advise you, if you're out there and if you're injured, if you're sick, to investigate what we're doing here. We're doing good work. Everybody in this clinic is dedicated to you. It's what we do. We enjoy what we do. We have a lot of interesting tools like Class 4 laser, pulse electromagnetic field therapy. We do a lot of spinal and joint decompression therapy, a lot of muscle work, a lot of neuromuscular therapy. We do a lot of muscle work. We do a lot of outside the box thinking in both the diagnosis and the treatment. I have a diagnostic ultrasound that I have right here in my clinic that I use on patients to see inside their body without exposing them to radiation, so we can get a good look at what's happening live. You know, if you have a bad knee, I can ultrasound that knee joint and look at the meniscus as you move your knee. And then we can see what's wrong. We can do a treatment to help fix that, and then we can re-ultrasound it and see the immediate results. If you know, it's amazing. We have digital x-ray machine right here in the clinic, so you don't have to be sent out for x-rays. We can take your x-rays and read them, process that information within 10 minutes. Of course, physical examination is always priority. We check your vitals, your blood pressure, your pulse, your oxygen blood levels. We also check something called heart rate variability, which is very important. This allows us to see if your nervous system is balanced. An imbalanced nervous system is going to be harder for somebody to heal. So if the system is imbalanced, we want to work on that. We want to work on balancing the autonomics so that your body's in a better position to heal naturally. Advanced Pain Solutions is my little gem. It's my creation. I've been in practice over 18 years. And this is the place I go every day to work. It's my lab. It's my everything.